Hello guys, once again Ijaz Hidayat is with you with new talk, with new session and with interesting new uh, medical profession. Today we are very lucky. Today we have one of our senior most uh, respiratory therapist, Ms. Shagufta Yameen. She did her bachelor in critical care technology in 2009 from Dow University of Health Sciences, Karachi, Pakistan. She was the top scorer during her education, and she come in first of 10 people who was the leading students who was doing the marvelous job during their education period. And presently she's appointed as the lecturer at Dow University of Health Sciences for respiratory therapist or critical care technologist in Dow University of Health Sciences. Ms. Shagufta, welcome to my talk show and assalamu alaikum. क्या हाल है?
Walaikum Assalam. Thank you, Mr. Ijaz. Thank you so much for inviting me for the interview.
So let's before, as you know, the pattern of this talk show is we first give a chance to our guest to give some brief introduction for yourself. तो उसके बाद फिर हम continue करेंगे अपनी education और further you could
Okay.
we'll have some few questions related to your field. So just introduce yourself for your education and what is your present post and where you're working and what is the planning for the futures as a critical care technologist.
I graduated from Dow University of Health Sciences. I was from the first batch. Uh, we were enrolled in 2006. That is, Dow University started its first batch in 2006. So I was passed on in 2009, and after completing my house job at Civil Hospital Karachi, I was appointed as lecturer because Dow University selected top 10 students,
Wow.
top 10 students for the job. So I was also appointed here for the job. Then after coming to the job, I have gained 12 years of experience. Now I have a 12 years of
So
experience
12
in
years is a huge
teaching.
number. Very nice.
So yeah, it's not just a teaching experience. I have been working as a QMS coordinator here, and I have been also working as a lead auditor. I have been auditing different departments of Dow University of Health Sciences as lead auditor.
Oh, it's similar like
So
we have in a hospital. We have the JCIA auditors came and they audit the things. So you are one of the person who's auditing
I,
the departments.
I have been working for the ISO certification.
Oh, very nice.
So in that, I was working as a lead auditor. So after so many, I have a gap in between my post graduation, in between my undergrad and post graduation. In 2018, I was enrolled in Masters in Health Professional Education at Jinas Medical University. It has been completed, Alhamdulillah, and now I'm going to be awarded with the degree in this December, inshallah.
Alhamdulillah, in advance, many congratulations from our side and from
Thank you so much, sir. Thank you so much, sir. In Pakistan, all the medical educationists they belong to MBBS or BDS.
yes.
But I'm the only one who is not MBBS or BDS.
Wow, good.
Thank you.
So now, Shagufta, we will come to your profession. First of all, I'm very lucky that you are with us and you are the inspiration for the upcoming critical care technologist, or we can say respiratory therapist. And you are doing a marvelous job in education, and Allah bless you more and give chance to serve to the nation of Pakistan, not only Pakistan, internationally or humanity. So I'm very happy for you. So I have few questions related to your profession, so people can understand, and even the my viewers can understand what is your profession, what is critical care technologist, what is their role, and what thing you are studying and how you are going to help to the patient. So मुझे बताएं what is critical care technologist? ये क्या है?
Critical care technology itself is a very special discipline. It deals with the patients who are on the mechanical ventilation, those who are vitally unstable patients. These professionals, they fight for the patient, they work for the patient, so that they work for those patients who are dying. They work for those patients who are on the death table. So they all struggle to bring that patient back to the life. So
So,
I think I don't think any other profession is more precious than this profession, because they are taking the patient back to the life. So
so
this is
what,
my point
so
of
what
view.
I am
So
understanding,
basically, what they do.
sorry, Shagufta, what I am understanding that your work is with the ventilators. So you are maintaining the
Yeah,
like the respiratory system of the patients during the patient is not conscious and they are not capable to breathe normally. So is this the same? What I'm understanding?
exactly.
Okay, okay, okay.
Yeah, it's not only the ventilator. There are many other things besides ventilator. Ventilator is the major
Part.
domain of respiratory therapist. So
Okay.
the main domain of the respiratory therapist is ventilator. But besides, there are many other things. Uh, Respiratory therapists, they try to maintain the airways of the patient.
Oh,
They try to keep the maintain the oxygenation of the patient.
okay.
They work with the ABGs, they work with the chest physiotherapy,
Okay.
and they do all the emergency procedures for the patients. And they are involved in the counseling of the for counseling of the attendants. They are trained to break the bad news, and many more.
So what is the time frame of this degree? How many years of this course? Is it this the degree program or is it like certification program? And how many years you have to enroll for the education to get a bachelor in critical care technology?
We follow HEC criteria, Higher Education Commission criteria. So
Okay.
according to that, all those students who clear their FSC, uh, they appear in the exam. After they are selected for the respiratory therapy, they continue their studies for 4 years. They study here for the 4 years, and after completing 4 years, they go for the house job in any of the hospital, especially or the Dow Hospital or civil hospital. So they work there for 6 months, and then degree is awarded to them.
So how many universities are offering this type of the degrees program, say like in Pakistan? Do you have any idea?
Uh, Yeah, initially, it was started by Dow University of Health Sciences. Before Dow University of Health Sciences, this program was already running in Shaukat Khanam Hospital, but it was of 2 years only. It was an associate degree.
Okay.
So Dow was the first university which introduced this program for the 4 years. With the house job, with the research work, all these things were included in this program. So, also they were also rotated for the clinical practices, for the clinical working.
How many universities are offering the
Okay,
critical care
okay.
technology? So like in Shaukat Khanum and then
It
Karachi.
was started with it was started by Shaukat Khanam Hospital for
So
the
this
two
Shaukat
years.
Khanum is in
For two
Lahore.
years
The
study.
Shaukat Khanum is in
Yeah,
Lahore.
yeah. Then Dow University started it for the 4 years. The 4 years program was started by Dow University, and then it is now this program, the same similar program is being run by JSMU, Janasin Medical University.
Oh, very nice.
There's Suhail University. There are Liaquat Medical College. They're also offering this program. So number of institutes have started
Okay.
this program, especially after COVID-19.
Okay.
During COVID-19, everybody just noticed that respiratory therapists are very much important for the respiratory care. So they are working with the ventilators, they are working with the non-invasive machines, they are providing the best chest physiotherapy, they are providing best respiratory care to the patient. So, looking at the role of the technologist, respiratory care technologist, respiratory therapist, most of the universities, even some of the hospitals, they also plan to initiate a respiratory therapy program. So they're quite a big number after COVID. This number has been turned into a lot.
Shagufta, I will add one thing more, that just for the information for my audience, those who want to become a respiratory therapist or technologist or critical care technologist, even in Middle East, you have a huge demand for the respiratory therapist or critical care technologist, because due to the COVID, the usages of
Yeah.
the your respiratory device is more demanding. So I think in the future you will find more demanding, this field will be a more demanding, and internationally you have a good scope. Those who are graduated in critical care, and they can work like in the Middle East, or they can work in Canada or somewhere, or in an international level. So there is a demanding, this field is very demanding, I am sure. And the step which was taken by the Dow is the great steps, and best wishes for your profession, and you're serving very nicely. Do you have any take home message for my viewers related to your profession? Who
Yes,
want to
sir.
become
Before
critical?
before going to the take home message, I would like to add one more thing, that RTs are not working in ICUs only. They are not working with the ventilated patients only. They are working in the rehabilitation centers. They are working as entrepreneur,
Very
which is
nice.
very good. They are working at in airlines. They are working
Yes.
in ambulations. So there are so many areas. They are working in academics. They are working in research. They are working in many projects. So they are not confined with the ICU only. If I want to change my area, I can easily switch. I can be easily fit in any a situation in any area. So I think it is a very good field, and I don't think this field will confine someone. There are so many doors, so many options in this field for the students after completing their graduation.
So thank you so much, Shagufta. It is very informative. Guys, see how this field, I just want to highlight about the critical care technologies, or we can say the respiratory therapists. In the short form, we used to say the RT. So RT is not only, as per Ms. Shagufta, is not only fixed only for the intensive care, only for the ventilators. They have the vast variety to work in a different part of the fields. Like you can work as a rehabilitations, as you mentioned. You can work in air ambulances, or in say as a CCP, like a critical care, like where you required. And as you mentioned, there is so many varieties, not confined actually. It was a great, and those who want to become a critical technologist, they can go through with the web pages of the Dow University of Health Sciences, and even for internationally, and then they can pursue this profession. Is one of the best profession, as if you're not able to get admission in like in a MBBS or in a BDS, you can apply for the critical care technologies, because this is also one of the respectable and like a humanity serve profession. So thank you so much, Mr. Gupta, for your precious time, and hope your interview is going to be beneficial for not only few, hundreds of peoples, hundreds of the young youth, and they can pursue as a critical care technologies, and serve to the nation, serve to the Pakistan, serve to the international community. Once again, thank you so much for your time.
Thank you so much.
Thank you.
Thank you so much, sir, for inviting me and conducting this interview. I would like to add one more thing. None of the field is good or bad. It is you who make it successful or who make it failure. If you
Beautiful
are
man.
working hard, your field is going to be successful. If you are not working hard, you are not paying attention, you are not dedicated, your field is going to be failed. Failure is not in the field, it's inside you.
Very right.
So
Very
similarly, success is not in the in the field. Success is inside your
true.
dedication, your hard working, and on all these learnings.
Very true. Very good message. Very, very good message. So it's mean do your best, and Allah will do the rest. So it's mean it's not
Yeah.
matter of any profession, matter of your how much you are like energetic, and how much you put your efforts to input for your profession. And it will automatically going to be
Yes.
shine. So you are also one of the shine star in this field, and you are the role model of more many of hundreds of the students. So thank you so much once again, Shagufta. Khuda Hafiz. Allah Hafiz. See you in next
Thank
time.
you so much. Thank you so much. Okay,
Thank you.
love this.
Allah Hafiz.